China, Britain, France, can veto much that might be proposed to address such issues. However, what we have learned is that it's actually possible to act outside of the Security Council. And so these treaties, the Cluster Munitions Treaty, the Landmines Treaty, and most recently the Nuclear Weapons Treaty, these have been conducted outside of the Security Council, where the majority of states have said, that's it, we've had enough, we want to ban these weapons. And so the treaties have gone ahead nonetheless. So that's a good thing. Now, in terms of constraining somebody like Putin, unfortunately, the Security Council, the UN, is generally stymied in what it can do. And without in any way wishing to condone what Putin has done, the same thing applies to the United States, for example. And we do know that the US has regularly flouted United Nations laws, and most egregiously perhaps in 2003 when it invaded Iraq, quite against the view of a majority of states and people around the world. So in that case also, the United Nations was not able to stop a state from invading another state and killing vast numbers of people. It's one of the drawbacks of the international system.
Kia ora, thank you for your time. That's University of Queensland Associate Professor Marianne Hansen. And just lastly on the war, a Russian court has extended the detention of the US basketball star Brittany Griner for another 2 months. The 31-year-old has been held in Moscow since February when customs officials allegedly found cannabis oil in her luggage. The accusation may carry a maximum 10-year jail sentence. Arguably the greatest female basketball player of all time, she is a double Olympic gold medalist. She went to Russia to play during the US League's off-season. In one of the last public sightings of her captured on CCTV, Brittany Griner is seen walking through security at a Moscow airport, trailing a small black suitcase. But a month after her detention, little is known about her circumstances. Now, the BA.2 subvariant of Omicron is moving through Europe and Asia at an alarming rate and is stoking fears of a fresh surge of COVID cases in the US. Its spread in the US comes as all 50 states lift mask mandates and other restrictions. CNN's Elizabeth Cohen has more.
It's 80% more transmissible than Omicron. That's saying a lot because we know how incredibly transmissible Omicron original is. And 23% of new infections last week in the US were BA.2, were this subvariant. 14% the previous week. So that's a big jump. It was only 14% 2 weeks ago, and it was 23% last week. Now let's take a look at places where there's even more of this BA.2. Part of the problem in the U.S. is that seniors, who of course we know are so vulnerable to COVID-19, a lot of them have not gotten their third shot, even though there's been so much messaging about this. In the U.S., 60% of seniors have gotten a third shot. In the UK, that's 81%. And the concern also is that when you look at that 40% of seniors who haven't had a third shot, for a lot of them, that second shot was a long time ago, maybe even a year ago or even more. That's a long time. And so it's all the more reason why seniors need to get that third dose. And we know that Pfizer has proposed giving them a fourth dose as well. That's in front of the FDA right now.
CNN medical correspondent Elizabeth Cohen. And James Bond is now officially an Amazon employee. The tech giant has closed its multi-billion-dollar deal to acquire MGM.
Welcome again to Tamaki Makaurau for today's regional update on the Omicron response here in the Metro Auckland region. I'm Dr. Anthony Jordan, Associate Chief Clinical Officer and Vaccination Program Director for the Northern Regional Health Coordination Centre. I'm also delighted today to be joined by Dr. Helen Patoussis-Harris, Associate Professor from the University of Auckland and Co-Director of the Global Vaccine Data Network. Today, we will provide the usual update on case numbers and hospitalisations, both here in Auckland and across Aotearoa. I'll also provide some more detailed information on vaccine boosters and their rollout across Auckland. Helen will answer any questions and provide some timely advice about the boosters. But first, an update on today's numbers. Today, there are 14,128 new COVID cases across Aotearoa, with 3,498 here in Auckland. There are 943 people in hospital, 616 of those are here in Auckland. There are also 25 people in ICU, 10 of those here in Auckland. We are sadly reporting a further 5 deaths from COVID-19 today. These are in Auckland, Waikato, the Hutt Valley and Canterbury. Every death we hear of during the outbreak and the ones before hit us hard, and we never want to lose anyone, so I want to send our deepest sympathies to those whānau who have suffered these losses. Our thoughts are with you all. As always, further details on all of these numbers will be provided by the Ministry of Health's 1 p.m. written update. As my colleague Andrew Old alluded to yesterday, we are now increasingly optimistic that we are seeing the peak of the outbreak here in Tamaki Makaurau. We are hopeful that this will also be reflected in our hospitalisation numbers. We are, however, continuing to see high numbers of people presenting in our hospitals with severe symptoms who have not yet been vaccinated or have not yet had their booster. Over the last month here in Tamaki Makaurau, only 11% of hospitalisations have been in those who have had their booster. You are 9 times less likely to end up in hospital if you have had your booster. My main message today is, as we continue to see these high hospitalisation rates, is to please go out and get vaccinated or boosted if you are eligible. It is certainly not too late. It will make a significant difference if you catch COVID, in particular to protect you from getting severely unwell and ending up in hospital. We know the booster dose will reduce your chances of dying, so this is always important for us. We understand the pressure that's on our healthcare system at the moment, so your contribution by getting boosted is appreciated. The other thing to remind ourselves is getting boosted also reduces your likelihood of passing on COVID-19 to others. And that's really important in our homes where we may have younger children not yet vaccinated or elderly people who may have other comorbidities and more at risk of getting unwell. I've said this before, the current rate of boosters in Auckland is lower than what I would like. But it's important to understand some of the challenges we may be facing, especially those who have recently had COVID and not yet able to receive either their second dose or their boosters. That said, we know our community partners are rallying once again to encourage their communities to come out and get that additional layer of protection. And we will talk about this a bit more later. What I'd like to do now, though, is hand over to Helen to provide some more background as to why we have a 3-month wait period and to explain what's happening to our immune systems over this period. Over to you, Helen.
Thanks, Anthony, and kia ora, everybody. I've been hearing a lot across various different platforms. Some of the questions people are raising, why do they need a booster? And I wanted to take some time today to explain why boosters are so important. And I think many people have forgotten that booster vaccinations are actually an important part of most vaccine schedules. In fact, most of the vaccines that we give to our infants and children have 2 or 3 primary doses, followed a little bit later, at least a few months, by a booster. And there's a very good reason why this is done. The first time we get a vaccine or we have an infection, our immune system has to start from scratch. and it makes immunity as fast as it can. This immunity is okay and can help us recover from an infection, but it is not the best immunity. Over the next few months, our immune system is working away to improve on that early response. In case we come into contact with infection in the future, we want the response to be very fast and effective. Even though the antibodies in our blood then start to dwindle, there's actually quite a lot going on in the background, especially the job of making better antibodies and a long-term memory of this. And this mature immunity can respond to more variants than the early immunity. So when we give a booster vaccination, we're actually stimulating the mature immunity that our body's been working on, and not just making more of the same. Boosted immunity lasts longer, and it is more effective than primary immunity. Boosted immunity can neutralise more coronavirus variants, which means you'll be much better protected when any of the new variants potentially hit our shore as well. And also important to note, there are no additional safety concerns related to boosters. In fact, data from New Zealand shows that the reactions after a booster are actually less disruptive than those after the second dose. So, the problem with Omicron. Omicron is different to the other variants, and 2 primary doses of the vaccine, of course, is not as effective as it was against Delta. So fortunately for us, the booster changes this dramatically. Boosters are by far the best way to protect ourselves against the worst symptoms of Omicron infection. Some vaccines require more than 1 booster to maintain good protection over time, and at the moment scientists are monitoring this situation, the pandemic, very closely, and we're learning so much all the time and about the best way that we can protect ourselves against this virus, and also to keep those around us safe as well. So the important thing is to make sure that you and your loved ones are up to date with your COVID vaccines, and that way you've got the best chance of protecting yourself, but also those around you, because it does limit that transmission from the very serious illness that we've seen in the outbreak. So another thing I wanted to touch on was pregnancy and vaccinations, as this is another area that we're getting a lot of questions about. Pregnant women and their unborn babies are a special high-risk group for severe consequences of COVID-19. This includes a higher risk of ending up in hospital and needing respiratory support, and also a higher risk of a pregnancy loss or a preterm birth if you get COVID while you're pregnant. Also, young babies are particularly vulnerable, and if you get vaccinated before or during your pregnancy or your breastfeeding, you can actually pass some of this immunity on to your baby. And very new data is showing that this immunity that you pass on does give them some protection against COVID-19. So it's okay to be feeling a bit uncertain, and if you are not feeling sure about getting vaccinated during your pregnancy, then have a chat to your midwife, your GP or your obstetrician. And remember that vaccination in pregnancy is very routine. We vaccinate and encourage vaccination in pregnant women against influenza and whooping cough. So this is not something that's new. And finally, another question I hear a lot about is whether boosters will be endless. Will we have boosters forever? It is likely that the main reason for giving more doses of the same vaccine in the future will be if a person's at very high risk of severe COVID. This might include older people and those with compromised immune systems. And in the future, there might be new formulations of the vaccine, and if new problematic variants crop up that don't respond to our current vaccines, there may be new formulations, and we might want to vaccinate against those. However, it all depends on how much trouble the virus is causing and in whom. Once most people in the world are at least partly immune to this pandemic virus, it means the impact on all of the people will ease. So I certainly hope that this has been helpful in answering some of the questions people might have about boosters and in vaccination in general. And I'll be happy to take further questions later, but I'll hand back to Anthony for now.
Thanks, Helen. So I think the message is clear. We are still dealing with an outbreak here in Auckland, and although numbers are coming down, it is moving across the country, and we still have people becoming unwell from Omicron. The virus is clearly seeking out those who are unvaccinated, so please get out and get your boosters or your first or second dose, and I encourage your whānau to do the same. There are many ways you can do this over the coming weekend. You can of course still visit any of our community vaccination centres, just walk or drive in, and there are hundreds of GPs and pharmacies across Tāmaki Makaurau who are open too. In addition, we have a range of great pop-up events happening across the city today and tomorrow. They include tamariki and whānau focused events in Papakura, Avondale, Henderson, Mangere, Otara, Glen Innes and Otahuhu. Some of these are running from as early as 8:30 in the morning until 5 o'clock. There's a later option too at Papakura Marae tomorrow, which is running an event from midday till 7 p.m. And finally, a reminder, you can always visit, make a booking, talk to us over the phone, and we can answer any questions that you may have. On a personal note, I would just like to thank everyone across the health sector and other sectors for their huge contribution during the outbreak so far. It is appreciated by all of us, and kia kaha, stay strong, and we're happy to take any questions. Well, as we knew in the initial sequencing framework, we saw a slower uptake amongst Māori, and this was particularly exaggerated in counties Manukau, and so we're seeing that still feed through. The most important thing is how we respond to that, so we need to work alongside our Māori community partners to ensure that those vaccination rates increase. We have seen high uptakes in some of those most high-risk groups, in particular those over 60, where those second dose rates equalised with other populations. So that's what we aim to do with boosters, and that's what we need to do.
Given those levels, do you think that the rollout to that population in particular has been equitable?
It hasn't been equitable. We knew that with dose 1 and dose 2, and we've talked about this before, that we need to continue always to correct for that equity, and that lag obviously has always been concerning for us, especially during an outbreak, because it's circulating, it's finding those people that are not protected. So we have to remain vigilant in those areas to lift those rates.
I've had some comments from Dr. John Bonning around patients in hospital waiting 24 hours in hospital corridors for care. Are you aware of this, and what's the extent?
Yes, so we know that getting the right bed in the right ward for patients who need COVID care or other types of care has been difficult at the moment, just with both the numbers of people coming through, and also we've talked about those people who come in with COVID or due to COVID, putting pressure on our negative pressure rooms across hospital networks. So yes, that is difficult for us, but we need to manage that. They're still getting good care in those areas. Obviously, corridors are not the place for people to be cared for, and we're trying to get them into the beds that are appropriate for them.
How many people are waiting that long?
I couldn't give you the exact numbers across the whole country, sorry.
Just on those 5 deaths that are reported today, have they all died in hospital, or have some passed away at home?
Those ones that are reported to us have died in hospital.
Now that we're going to be out from the peak, would you be comfortable moving to a alert level orange?
So the question is as we come down from the peak, whether or not we'd be comfortable moving to alert level orange. It's not really my decision to make changes in alert levels. What I would say is what we're seeing here in Auckland doesn't necessarily represent what's going to happen in the rest of the country. So it needs to be balanced between changing an alert level based on what's happening here versus what may happen elsewhere.
With cases dropping in Auckland, do you think we need to shift how we're testing people? The current advice is to get a test if you're symptomatic or a household contact. Do we need to start testing people who are asymptomatic just to see where this virus might be hiding?
I don't think so. The only time, obviously, we're suggesting people to test asymptomatically at the moment is when they're a household contact. So I think we should continue on with that program of work. The main thing we need people to do is to report both their positive and negative tests. That gives us a much more accurate picture of what's happening in the community. Remembering, even with a sample of tests, we get a really good idea about what happens across the wider community.
Are you still finding it problematic with people not reporting their results?
So we are obviously distributing more RAT tests than we're seeing results uploaded. That's to be expected, though. We put a lot of tests out there so that people have them when they need them. Not everyone may use them right away. But obviously in the back of our minds, we're always thinking, are all of those tests being uploaded, especially the ones where people are negative? They may think that's not important, but it is incredibly important for us to know.
Just on Ed's question, one thing has been told by a nurse at a testing station that there's a 10-day delay in terms of getting that PCR result back. Does that make the test pointless because the infection could have passed through in that 10 days?
The only thing I would say is that's very, very unlikely at the moment. Our PCR turnarounds are much lower than that because of the volume of PCR tests that came down with the introduction of RAT tests. So I'd be very surprised if there was a 10-day wait anywhere in the country at the moment.
What's the message to people who are still believing receiving 2 doses is enough to do their part? Don't think anything.
So the question is, if you've only had 2 doses, why you need to get your booster. It's exactly what Helen just said before. The protection comes and is matured and more protective if you get that boosted dose for Omicron. So they should go out and get their booster.
Just on boosters, you mentioned that you would have liked it to be at a high level at this point. What specifically would you have liked it to be at now?
So the question is, how high would I have liked it? I would have liked it as high as possible. I would have liked it over 90%. You're always slightly thwarted by the fact that when Omicron arrived, it pushes out that ability to get that boosted rate up as high as we potentially saw with dose 2s. And that is something that obviously we have to be mindful of.
Now, we have confirmation of an extension to the $500 bonus that hospital staff receiving for doing internships.
So I think Andrew covered that off yesterday and also this morning in an interview that decision is currently being reviewed by the DHBs today, and I don't have any further information on that at this stage.
Are you aware of the total payment that doctors receive?
I'm not sure of the further figures related to medical staff.
Do you expect that booster rates will plateau now that there's advice for people to wait after they've had a COVID infection before getting a booster?
Do you want to talk to that?
Yeah, I think that's very likely, but given the sheer number of infections that we've got, and I think that delay is giving also, as mentioned before, a 3-month delay can give a person who's had the Omicron opportunity to again mature that immunity and then boost later on. So, but that I would expect will lead to some delays. Yes.
Helen, you mentioned that you're seeing some commentary around reluctance for boosters. Are there any specific demographics that you're seeing, Helen? Whether it be populations across the country or specific kind of people?
I haven't, but certainly this I think misunderstanding. I think you mentioned something before that two's good, two's enough, and that we are seeing people boosted who are in hospital, but of course they're in a very few out of a very big pool of boosted people. So I do think that there's that misunderstanding, and the misunderstanding that a booster's just giving a little bit. You're just starting again, and you're not, of course. So it's a very different response, and also that you might be giving too much of this vaccine. which is definitely not the case and is a very normal sort of process that we're working with. So I think not that I'm aware of. I think that I could be wrong, but I think that, that those are probably reasonably common thinking. Yeah.
Helen, do you continue to have concerns around misinformation and vaccinations, for example, for pregnant women or around boosters?
Yeah, so do I have concerns about the misinformation, especially around boosters and pregnancy? Absolutely. I think that's been one of our biggest challenges throughout this pandemic, and also before the pandemic with vaccinations, is the issue of misinformation, and I think that's grown. So it's an enormous challenge for us.
When you say it's grown, how do you see the growth in the past couple of months?
It's grown. The growth has been both in magnitude and reach and speed. So it's also something that's reaching more communities than it used to. So this has been posing a challenge across the board in all population groups to some extent.
Anthony, we've had confirmation that two key providers have finally received some funding for self-isolation work that they started about 4 or 5 months ago. We're glad that they've finally got it, but is it acceptable in your view that it's taken this long to finally get that funding?
No, it's not acceptable. We always try to make sure that we pay our providers in a timely fashion, and that's definitely our plan moving forward, to get those payments out to people in timely fashion. So we continue to monitor this with our planning and funding colleagues as well.
One of the key things that they've been asking for is kind of to do what it takes funding approach, whereby providers can go, right, this is what I need to get it yesterday, and we go forward. Is that a key priority for you guys going forward?
Definitely. I think we have to knit up those systems in the background so that they can get the money for what they need to provide. Obviously getting those contracts for them tight enough to enable them to do it, so there isn't delays in the future with payments coming through. Obviously what we've seen in the pandemic is a whole of system approach, so you've got health, you've got social welfare as well, and making sure that those funding streams are accessed in a timely fashion for providers who are working across that whole response.
And nationally, we've got about 3,000 people who are waiting daily for welfare support. What's your impression on that level of people?
Yeah, I think it seems like a lot of people waiting, obviously, and we're obviously at the moment seeing our peak numbers here in Tamaki tailing off, but obviously that'll be spread across the country, so I expect those numbers to remain a bit higher for a bit longer. Remembering not everyone comes out of isolation at 7 days either, so there may need to be ongoing support for those whānau that are having to isolate for longer periods of time as well.
Seeing as the patient cases have reached already, are you expecting the same for hospitalizations?
So the question is, as we start to see the peak here in Auckland, what will the effect be on hospitalisations? Have they peaked as well? I think we need to wait a little bit longer before we make that call. Remembering people tend to get very unwell with Omicron and Delta and other previous strains of COVID-19 after 7 days. So let's wait and see. There may be higher numbers in hospital in the coming days, but hopefully as those case numbers in total come down, that will have an effect on hospitalisations moving forward. One more question?
Well, we've seen child vaccinations go off score essentially over the last couple of weeks, or grow very, very slightly. Why do you think that is, and what's been done to fix it?
Do you want to?
So the question was around the stalling of the childhood vaccinations, and I think this is a really, really important question, because we're going to enter a time where we've got a lot of infectious agents now coming across our border, and we're ill prepared in terms of our vaccine coverage, which has continued to fall since about 2016. So we're facing potentially whooping cough, pneumococcal disease, among others. and measles. What's being done to address it? I mean, I think this is a really good question, and I think this needs to become an absolute focus on how we can actually turn this around and really quickly. And I don't know what the plan is at the moment and in the current environment to address that issue.